Hello, everyone. Thank you for joining us today for our webinar on Security 101, Keeping Patient Information Safe. Let me start by introducing myself. My name is Maral Sanastian, and I'm the Director of Client Success at DoctorCare. Before we get started, I'm just going to share some webinar logistics. So that you know, all attendees are in listen-only mode. We are recording this webinar, so it will be available to you after the event. If you have any questions during the webinar, please submit your question in the Q&A feature. Your questions and your identity will be kept confidential and only seen by us. We will do a Q&A session to answer some of your questions at the end of the webinar. So, without further ado, let's get started. We are very excited to be sharing this webinar with you all, featuring our partner, Secure Solutions Now. Secure Solutions Now, created by Well Health, provides advanced cybersecurity protection to defend against costly ransomware attacks and help manage all of your IT needs. Secure Solutions Now is a collaboration between Source 44 Security, providing security services, and Bluebird, providing IT services for medical clinics. On average, IT downtime costs businesses 200 minutes to resolve, which is time taken away from taking care of your patients. Secure Solutions Now proactively monitor your computer system around the clock, and you will have access to incident response teams. Their solutions help enhance and improve Office functionality and provide peace of mind that you are being protected. Today, we have a special guest, Jeffrey Sims from Secure Solutions Now, who will be our main speaker for today's webinar. I'll pass it on to Jeffrey.
Good day, everyone. I'd like to start off by thanking DoctorCare for hosting today's presentation, as well as all the attendees for showing up today. I'd like to start off just by introducing myself. I'm Jeffrey Sims. I'm the Director of Cybersecurity Services for Source 44. I've worked in cybersecurity for a bit over 15 years. I started my career doing digital forensics. I worked with police departments. I worked with private investigative firms. Did everything ranging from murder cases to human trafficking and everything from there. After moving out of that part of my career, I moved into what's called incident response, which is when we get shipped into companies that have been breached, and we're there to stop the breach and do triage and help them get through it and get everything cleaned up with as little data loss and destruction as possible. From doing that, one of the main things I was asked from all my clients is, how did this happen? How could have we prevented it? And so that switched me a little bit more into doing what's called penetration testing. This is when I get hired to break into companies and tell them how I did it before bad guys can do it. And that led into more of what I do now, which is security consulting. And I go into companies like your clinics and work with you to understand what security risks you have, what type of protections you have in place, and how we can improve those things.
To be very clear, I'm not a medical professional. Any medical information found in this presentation is from government sites or mass media sites, and they're only being used to illustrate some concepts. Primarily, the examples I'll be given are based off COVID-19 restrictions. I'm not making any judgment on those restrictions, their effectiveness, or anything else. I'm not qualified to make those judgments. But they do make strong analogs to cybersecurity controls, because a lot of how we deal with cybersecurity is based off of how epidemics have been handled throughout history. So they just make talking about it through analogies really easy. With Security 101 in the title, it may surprise people, but this presentation isn't about the basics. They're a good start, but they really are the minimum. I hope most people are following these practices, but if anyone needs a refresher, I'm going to cover them right here at the start. We're going to go through them a little bit quick, but hopefully it covers it enough that people understand what they're about. The first thing you can do is patch everything. And this is more complicated than people think, because it's not just your operating system or the applications that automatically update when you turn them on, like Chrome or Firefox. You really need to understand what software is installed on every computer, what drivers they're using. In other devices like your printers or network devices, such as your wireless access points, switches, routers, they all need patches and updates. And a lot of people don't even know how to update them, never mind when they should. The next thing you can do is use a password manager. You want really long and unique passwords on every site you use. And you want to use multi-factor when it's possible. You also want to have some type of endpoint protection. Traditionally, most people used antivirus programs, but realistically, the more modern endpoint detection and response programs work a little bit better and offer more control. Next, you want something that does URL filtering, DNS filtering, either of those, because you want to allow access from your clinic only to known good sites. We can get a lot deeper with that with different control systems and filtering, but that's a good start. And finally, you want some type of email filter, something that does reputation-based filtering, prevents phishing, scans for attachments to see if they contain malware, and even control links. And you want it to control links both on when the email is received as well as when the link's clicked, because there's some tricks that hackers and stuff use to get around a single scan attempt. So if we aren't going to talk about the basics, what are we going to cover today? Well, my main goal is to help you look at your clinic through a security lens. And to do that, I'd like us to ignore the technical parts. Security is normally broken up into two groups: risk and compliance and operations. Today, we're going to be focusing on risk and compliance because that's who aligns security to the business needs. It's who writes the policies and procedures, decides what needs to be done, whereas operations is more about implementing controls to enforce what risk and compliance has put in place. So leave that to IT. Second, I'd like to reflect on how you protected your clinic during COVID. I assume you looked at how different staff members interact with the public and their exposure risk in those interactions, and put policies and procedures or protective measures in place to protect them. That's what real security is about, looking at how things are done and what risk is associated with it. Third, I'd like you to think of cybersecurity like a pandemic. The concepts are very similar and how we address them are very similar. Finally, I want you to feel confident to participate in your own security discussions. If that means bringing in a third-party consultant like myself, or just having conversations with your staff, it's important to have security conversations. So like talking to your staff about things like an email coming in that looks like it's from you, asking for them to purchase gift cards. I actually hear about things like this fairly often, and people actually buy the gift cards. There needs to be processes in place, which would be something simple like phoning you on a known good number. These are the type of things that are important to security, much more than the technical details. At its core, security is really about risk. It's the language of security. When I'm doing user awareness training, I like to talk about risk a little bit. We don't go too in depth, but we look at it with the analogy of crossing the street and when you're willing to risk it. If the traffic lights are green, but there's no cars coming, is it safe to cross? A lot of people would say yes. Well, what if you had a puppy with you? Would that change your opinion? What if it was dark, late at night, storming? It was hard to see, but you don't see any lights coming. Is it still safe to cross? What if there's a police officer on the other side of the street? It's a different type of risk, but is it still safe to cross? What if we change the scenario slightly? You're no longer the person crossing the street. You're a driver. The light's red. You don't see anyone. The street's empty. Do you go through it? These are all different types of risk, and people understand that. But often when we're talking about risk, the language gets jumbled. It's common, especially amongst IT people, to hear words like risk and vulnerability used almost interchangeably. But while we have these discussions, I think it's important that we define some of these words so we know we're talking about the same thing. For me, risk is the probable frequency and probable magnitude of future loss. This is based off the FAIR risk assessment model, and the chart below it is a summarization of a piece of that model. Now, the two sides break down the probable frequency and the probable magnitude. The probable frequency is based off of how often that threat event may occur versus how strong that threat is against an individual's resistances and protections against it. The magnitude of the future loss is a little bit more complicated because it looks at what the primary loss is. So what's the first impact of that threat event and how bad that could be. But then it also goes into the secondary risks that are associated to that and what their impacts are. And that can be a long iterative process of all those things. In the context of security, when we're talking about risk, we're normally talking about how to reduce it. Unfortunately, there's not a lot of ways, but the 5 primary ways that we reduce risk is by reducing exposure, which reduces the event frequency. This is normally done through things like isolation or limiting risky activities, by reducing our vulnerability to a specific threat, ultimately increasing our resistance, or introducing some form of compensating control, an aid or something that either stops or hinders the threat. And then on the loss side of things, we can mitigate the impact potentially, or we can transfer the risk, which most commonly is done either by outsourcing or insurance. You may already be able to see how these relate to COVID, but we're going to get into that. Well, on the Government of Canada's health site, I found a link for My COVID Visit Risk Calculator. It's a website put out by the National Institute of Aging. They claim on the site that it is not medical advice, but they're heavily endorsed by a lot of medical associations, and it's based off of a lot of research papers put out by the medical community. So I was interested to see what factors they looked at and how they calculated the risk of a visit during COVID. The site actually asked a lot more questions than I was expecting. There was well over 50, so we're not going to go into all of them. But some of the factors they were looking at were things like the number of people attending the event, local infection rates, and what type of activities we'd be doing. These things each impact the threat event frequency or risk of exposure. They also asked about things like age and health conditions, because these things could be vulnerabilities to COVID. They also asked about vaccinations, because these could increase our resistance. They also asked about the ventilation systems, if the windows would be opened, because these things can limit COVID's ability to spread. On the primary loss side, the site was clear. It was looking at the risk of acquiring and or dying from COVID, which could be increased or reduced based off of health conditions. It could also be impacted by your age and whether or not you have vaccinations. They didn't go into the secondary risks, but some of the common secondary risks of COVID are things like spreading COVID to loved ones or coworkers. You have to take time off work, which could be a financial impact. And overall, it impacts the entire health system. Using that as a framework, I'd like to discuss how certain COVID-19 measures, at least with simplified objectives, translate fairly well to cybersecurity controls and how they relate to the risk reduction methods we discussed earlier in the presentation. One of the most common tools I saw used during the COVID-19 pandemic was that of segmenting people. We did that with national travel bans, provincial travel bans, county travel bans, and the more extreme version of that I saw was social circles. In Ontario, we were asked to find a group of 10 people and all agree that we'd only socialize with the same 10 people. This had a goal of if a person in a group was exposed to COVID, it would stay within that group. This is the same thing we do with cybersecurity with network segmentation. We use firewalls primarily to isolate users from servers and phones and printers and separate the guest network. This is also that if an individual device is infected, the spread's limited to what it can talk to. These are examples of reducing exposure via isolation. A more extreme version of this would be the extra screening we did for long-term care homes. If you wanted to visit someone, you had to go through a number of checks. The goal was to reduce the exposure to vulnerable people. We also do this in cybersecurity with something called zero trust network access. It allows us to put checks and controls in place, including things like who's logged into a device, is the device controlled by our organization, does it have an up-to-date antivirus, all kinds of things, all with the goal of isolating and reducing exposure. Then we have things like ventilation systems, which filter out pollutants by the size of particles and stuff like that. It's very similar to how in cybersecurity, email protection's used to filter out spam, phishing emails, potential viruses. These are examples of compensating controls. We also used vaccines, which in general taught the body how to identify viruses and create antibodies. Endpoint protection and response in cybersecurity does a very similar thing. We teach the system how to identify not just a virus, but viruses in general or virus-like behavior, and then it can shut down the services or programs responsible. We're reducing vulnerability and reducing the impact. Then we had things like travel quarantines. General idea, when someone goes through in travel, it puts them in a riskier situation than their normal life. There's a lot of unknowns, so we'll isolate them until we know they're healthy. This is the same thing we do in cybersecurity with blocking newly registered domains. 7 out of 10 domains are malicious, so until we know one's safe, we'd like to reduce it, which is a type of reducing risky activities. Now I'd like to tie that all together and see how we can use it for cybersecurity in your own clinic. We're going to start with primary loss. This is the traditional starting point because it's the what we're protecting or protecting from. Often when we talk to our clients about what they're worried about, they tell us ransomware, so I'm going to use that for this example, but this same technique can be used for almost any cyber incident. What I'd like to do is take the risk reduction methods we talked about earlier in the presentation, apply it to ransomware, and see how we can reduce risk. I'm going to start by reducing our exposure. We're going to use things like network isolation. We're going to make sure we separate things like BYOD devices, because these are devices we don't control. They pose undue risk into your environment, so we'd like to keep them isolated from the things you want to keep safe. We could also look at reducing risky activities, so going to questionable social media sites, places where you can get free books or free software, newly registered domains. These behaviors, while not necessarily bad, they have a higher frequency of being malicious, and we want to reduce the overall probability of exposure. So these are just good methods to reduce that exposure. The next method we could look at would be reducing vulnerability. By applying patches, we may remove vulnerabilities that the ransomware is using to spread. So we may be able to protect ourselves that way. Additionally, we could reduce our vulnerability using antivirus software. It may be able to detect and stop the ransomware before it can impact our systems. We could have other compensating controls, things like email filtering. Email filtering is good at stopping phishing and a lot of other things like that coming in. But that's also how a lot of ransomware starts. It starts with phishing or a bad attachment, a link to a malicious site. So by filtering that out before we're ever exposed to it, we're going to reduce our probable frequency. Now, we can also look at other methods, such as reducing the overall impact. One of the big impacts with an event like ransomware is loss of privacy. So we could reduce the impact of the event by outsourcing our EMR, having that in the cloud and not our own environment. If we were infected by ransomware, we wouldn't have that privacy loss, which may also reduce our downtime because we'd have other means of running. And finally, we could do things like transfer the risk. This is, once again, outsourcing would transfer the risk, but so does things like insurance. So there's different factors you can look at. And at the end of the day, it comes down to your own risk appetite. Some of these things may not be that risky to you, but this just provides a way to look at it and assess that risk. Hopefully that's provided you a new way of looking at cybersecurity, and that you can use this type of risk-based methodology to look at your processes and procedures, especially with your computer systems. If you have any questions, please feel free to submit them.
First one is, so I'm very concerned about my cybersecurity, clinic cybersecurity. Where do I even start?
I like to refrain from telling people, here's what you need to do. One of the parts of security that's fundamental to me is understanding the risk. That's why we started off by discussing how risk works, gave a good definition of it, so we can talk about it. There's certain things that are really generic. Email protection is important. Why? Because 90% of attacks are coming in through phishing as at least a piece of it. Having good endpoint protection is great, but past some of those basic things, it should be individualized to you. You should have a provider, a security provider that works with you, understands your environment and your needs, because they're going to change. So simple ideas on that. If you have an on-prem EMR system, is that isolated within your network? So same with all of our COVID stuff. Isolation, reducing exposure is so critical. It's one of the fundamental ways that we reduce risk is by reducing exposure. So understanding what you actually have in your environment becomes critical to having a security path. But as a starting point, email, endpoint. After that, I normally move into things like web filtering and stuff. That covers a lot of the generic stuff. After that, it should be tailored to you.
Okay, one more question. So why do I even need to worry about cyber security? Doesn't my EMR provider take care of that?
I can answer this two different ways because there's a big dividing line here. And in both cases, the answer is not entirely, but I'm going to draw it as two separate ways. If your EMR provider is a SaaS solution, so software as a service where it's being hosted on the internet, you connect through a website, things like that, your EMR provider is doing a lot more for the security. They own the underlying infrastructure, they own the software and the application, and they are responsible for the security of that. They're also responsible for data at rest, all of your information, things like that. But you still have a responsibility in this equation. And where that is you have responsibility on the permission side. So you can control access to your EMR systems. You decide who has access to them, what permissions they have, things like that. So if you have staff onboarding and offboarding, having a policy and procedures for offboarding staff and removing access to your EMR system, that part's almost always on you, even if the EMR provider is doing the adding or removing of those accounts. You still have to inform them that staff's left. So there is some shared responsibility there. Now, when you have an on-premise EMR system, more of the security responsibility is on you. So with an on-premise one, now the physical hardware may be owned by you. They may just install software on something you own. They're not responsible necessarily for the security of that hardware if it has up-to-date drivers, the underlying operating system, things like that, never mind the network security and the environment that is contained with it. If you have a dangerous environment, then now you're putting that stuff at risk. Not to say that a clinic is necessarily a dangerous environment, but the idea being, if you have places like you've opened it up, you want guest Wi-Fi in your clinic, but it's all one giant network. Well, now the guest Wi-Fi can connect directly to your EMR system. So that would be something that's more on your responsibility or your security provider's responsibility to help you design around those type of things. So there is really two methods depending on what type of EMR system you have.
Thank you everyone for joining us today for our webinar. I'd like to extend a special offer to all of our webinar guests joining us today. Until November 30th, 2022, Secure Solutions Now will be offering all attendees a complimentary security assessment. They will work with you in identifying the level of security in your practice and provide you with guidance on how to keep your clinics and patient data protected. If you would like to learn more, please email us and we can help you get started. A great thank you to Jeffrey and Gerard from Secure Solutions Now for joining us today. For the questions that we didn't get to address, we will reach out to you directly to answer your question. Thank you to all attendees for joining us on our webinar. We will send you an email of the recording in the next couple of weeks to share with your fellow doctors. In the meantime, if you have any questions or feedback on this webinar, please feel free to contact us anytime. Secure Solutions contact information is listed on this slide. We'll see you at our next webinar.